Therapy with Survivors of Narcissistic Abuse, Part 5, How Clients May Test Pathogenic Beliefs. Well, as a therapist, you have an almost infinite amount of choices in each moment as to what to pay attention to, how to respond, and what to emphasize with your clients. I think theories of therapy give therapists a strategy for how to do this in a way that should be helpful to the client. Well, one aspect of control mastery theory that I really like and find effective is the idea that clients will find ways, often unconsciously, to test whether their pathogenic beliefs apply in the therapeutic relationship or hopefully not. And they can do this in all kinds of ways, but if you have a good understanding of their goals, pathogenic beliefs, and key traumas, then you'll be in a good position to catch these tests and hopefully pass them. And in this video, I'll give an example of how Sarah, the kind of fictional client I've been talking about, tested her therapist in her therapy, explain two different types of tests, and describe how you can know if you've passed a client's test. Well, this video is the fifth in a series on control mastery theory and how you can learn to apply this approach in your own clinical work. It's a 6-part series that covered these topics. Part 1 was an overview of control mastery theory. Part 2 was the client's goals. Part 3 was the client's pathogenic beliefs. Part 4 were the client's key traumas. And today is Part 5, how clients may test pathogenic beliefs. Part 6 will be 5 steps to case formulation. Well, my name is Jay Reed, and I'm a licensed psychotherapist in California who specializes in the treatment of survivors of narcissistic abuse. And I work from a form of therapy called control mastery theory, which prizes the client's efforts to overcome the traumas they've experienced and realize a fuller and richer quality of life for themselves. If this topic interests you, then I encourage you to learn more by getting my free ebook on the topic. It's titled Effective Therapy with Survivors of Narcissistic Abuse, The Basics of Control Mastery Theory. And you can find it in the link to it in the description box below or by clicking here. Well, I'd like to talk about how Sarah tested in her therapy. Before talking too much about testing as a concept, I'll provide this example so that the concept becomes a little more clear. So Sarah was introduced in the first video of this series, and she came to therapy complaining of anxiety, feeling empty and depleted, and feeling stressed most of the time. Her therapist understood that she had experienced the key trauma of having a depression-prone father who threatened to be completely unavailable to her if she didn't do something to cheer him up all the time. And she coped by then, the therapist inferred, adopting the pathogenic belief that she does not, that if she doesn't take responsibility for others' emotional well-being, then they will fall into depression. Third, the therapist defined a goal for therapists that might reflect her then putting her own emotional well-being first, as her engaging in a regular form of exercise which she enjoyed, say like swimming, because that would reflect her putting her own needs first in her life. Well, Sarah started her therapy by criticizing herself for not being more attentive to her husband. And her husband seemed emotionally fragile and constantly on the verge of panic attacks. He also, though, refused to seek therapy or medication for his condition, and Sarah was consistently preoccupied with how he was doing. Is he okay? Her therapist held the hypothesis that her husband reflected Sarah's compliance with her pathogenic belief by her choosing a partner who seemed to be on the verge of falling apart if she were not kind of consistently or always tending to his well-being. Well, a therapist inferred that Sarah's claims that she was to blame for not taking good enough care of her husband were a test of her pathogenic belief. The test was to see whether her therapist would go along with her pathogenic belief or not. That is, would he, the therapist, agree that she was responsible for her husband's emotional well-being, or would he promote Sarah's efforts to address her own well-being? Well, her therapist responded initially by asking whether her husband had taken initiative to get professional help for his anxiety. Sarah said he had not, and her therapist then asked, well, how was that for her? Sarah initially said, well, what does it matter what I want? I mean, he's in need, and I'm the only one he trusts to help him. Her therapist responded with, well, from my vantage point, I see one partner who is suffering, that's your husband, but is not being a participant in his own rescue by seeking therapy or medication for himself, then you, Sarah, seem to understandably feel responsible for his well-being and actually suffer because it's a constant job to try to keep him afloat. And again, this is from my vantage point, but that doesn't seem fair to you. In that moment, Sarah sat back in her chair and it looked like a balloon had been let out inside of her. She seemed immediately more relaxed and said, "I never think about myself with him, and it's so hard." Well, in this example, Sarah tested her pathogenic belief by expressing an attitude towards herself that was in compliance with that belief, and that was that she wasn't taking good enough care of her husband. Her therapist then took the position that countered this belief by advocating for her right to take care of herself, even if that left her husband to take care of his own emotional well-being. And we can infer that her therapist's response passed Sarah's test from her seeming less stressed and bringing up other content of how hard it has been for her to be the one doing all the work to keep her husband's anxiety under control. Well, I hope that example served as an illustration of how a client may work to offer a therapist a test of their pathogenic belief, and an example of how a therapist's response can result in passing that test. Well, there are essentially two types of tests. Joe Weiss and Harold Sampson, the founders of this theory, called these types of tests transference tests and passive into active tests. Well, transference tests are efforts by the client to act as they would have with their traumatizing caregiver to see if the therapist will respond differently. So Sarah conducted such a transference test to see if her therapist would challenge her compliance with her pathogenic belief, or would the therapist endorse her abandoning her needs to take care of her husband. The bulk of tests in therapy, I would say particularly when survivors of narcissistic abuse, tend to be transference tests. Well, later, Sarah conducted a transference test by not complying with her pathogenic belief. In this instance, she came into therapy and said that she had told her husband that if he did not find a therapist by the end of the month, that she was not going to be available to him if he wanted her to talk to when he was anxious. Her therapist emphasized in that moment how she seemed to be acting as though her needs were as important as her husband's. And when the therapist said that, Sarah again appeared more relaxed and expressed how she initially felt a little guilty to tell this to her husband, but then felt like a burden had been lifted after telling him this, and that she was doing something that was caring towards herself. Well, it's important for therapists to pay attention to clients' efforts to test their pathogenic beliefs by complying with them and by not complying with them, so that the therapist knows what efforts to challenge and which ones to endorse. So if a client is acting in compliance or expressing an attitude in compliance with their pathogenic belief, that's where a therapist would want to kind of challenge or at least show curiosity about the client's sort of claims in such a moment or assumptions. In the case where the client is acting out of compliance with a pathogenic belief, that's where a therapist may want to be very affirming towards the client's efforts. Well, the other form of testing a pathogenic belief for clients is called passive into active tests. And they're sort of outside the scope of this video series, but I do describe them in my 3-hour course on effective therapy for survivors of narcissistic abuse. And if you're interested, you can find a link to the course in the description box below or by clicking here. Well, how do you know if you passed a client's test or not? There are several ways that a therapist can know if they've passed a test. The client may, and this is a quote from Joseph Weiss's book, How Therapy Works. The client may demonstrate greater confidence in the therapist, a sense of relief, greater insight, or more boldness. And the single most important indicator of a past test is that the client is getting better. And getting better can be defined in a lot of ways. But generally, if a client seems more emboldened to live as the client yearns to live, then a test may have been passed. And these signals provide iterative feedback whether the therapist is on the right track or not with the client. In contrast, if a client kind of stops their train of thought after a therapist has made an intervention, then that is often the sign of a failed test. Similarly, a failed test may precede a client becoming less engaged in the therapy. So for instance, showing up later than usual, forgetting to pay the bill, or finding it harder to make use of the therapeutic hour in one way or another. So as I've discussed, a test is designed to see if it's safe in the therapy for the client to be ways that would have endangered earlier important relationships. And if the therapist responds in a way that is aligned with the client's goal, then we would expect the client to feel that it is safer to act this way in the therapy. Whereas if the therapist responds in a way that indicates it's not safe, then we would expect the client to be less engaged in the therapy and of course find therapy to be less safe. And the culprit or smoking gun for failing clients' tests is often having a flawed case formulation or conceptualization. But if the therapist has accurately determined the client's goals, interfering pathogenic beliefs, and the key traumas that led to those beliefs, then it can be a lot more clear what ways of responding to the client will be found to be helpful and to increase the client's sense of safety. The concept of testing is essential, I think, to understanding and utilizing what I think is the power of control mastery theory, because it really affords the therapist an opportunity to listen in a very specific and targeted fashion to the client, which, if done correctly, promotes the client's experience of feeling understood, attuned to, and ultimately, when you're listening in a way and then kind of have in mind how you might respond that will counteract the client's pathogenic belief, it can allow the client to feel safer with you in the therapy. And that increased sense of safety, I think, is worth its weight in gold, therapeutically speaking. Well, I hope that today's video has been helpful in laying out more how clients work in therapy via testing to disconfirm their pathogenic beliefs so they then feel freer and safer to reach their important goals. In the next video, I want to put it all together and take you through 5 steps based on what we've discussed in these first 5 videos to formulating a case from the perspective of control mastery theory.